When thinking in terms of what Medicare covers, it's really important to understand Medicare Part B, the medical side. Remember, Part B is the medical side of Medicare. This is the part of Medicare that's the most used because it covers all the outpatient medical that's needed outside of the hospital. Here are some of the most common services that are used under Part B. You have your doctor visits that fall under primary and specialist. You have preventative care. You have outpatient surgeries and procedures. You have durable medical equipment. You have things like chemotherapy and ambulance rides that all fall under Medicare Part B. Let's discuss again the Medicare Part B deductible so that we're an expert here. Medicare Part B has a deductible that must be paid first before Medicare pays anything for medical expenses. The Part B deductible for 2021 is only $203, and remember, it's a calendar year deductible. Medicare's calendar year runs from January 1st through December 31st. Once the Part B deductible has been met for that calendar year, the individual will be responsible for that 20% coinsurance. Remember, Medicare will pay 80% and the individual will be responsible for that remaining 20%. Here is the problem with Medicare's coinsurance. Medicare does not deal in copays like most group or individual plans. They operate on the basis of coinsurance. See, the problem with Medicare is that unlike most health insurance plans available on the market, Medicare Part B does not have an annual cap or a stop loss for that remaining 20% coinsurance. That is the individual's responsibility and has always been a major problem with Medicare. Let's talk about the Medicare Part B deductible over the years. This is something that we would get a question all the time, and we still get these questions all the time about the Medicare Part B deductible. What's going to happen with it? Is it going to go up? In order to get a grasp on the Medicare Part B deductible, let's look back at the Part B deductible for the last 10 years. In 2010, the Part B deductible was $155. Today in 2021, it is $203. So over the last 10 years, the Part B deductible has gone up an average of $50 in the last 10 years. In order to fully understand Medicare Part B, there are two types of services that are covered under Part B. There are typically two types of services. One falls under what's called preventative services, which are services to prevent illness or detect health issues at an early stage. The second is medically necessary services, which are health services or supplies that are used to diagnose or actually treat a medical condition. Medicare Part B will fall under one of those two services. Let's talk about preventative services. Medicare Part B will typically pay all costs for preventative services. The Part B deductible and the 20% coinsurance will not apply for preventative services. A glaucoma test is frequently listed under preventative and screening services, but Medicare does not pay all costs. If someone's at a high risk for glaucoma, Medicare will cover a glaucoma test once a year, but the Part B deductible and the 20% coinsurance will actually apply. Here are some common preventative services that are covered by Medicare Part B at no cost. There's a one-time Welcome to Medicare Preventive visit. This is covered within the first 12 months of getting Part B. This visit is to review the individual's medical history and let them know of screening, shots, and the frequency of preventative services that are specific to their needs as they start getting older. You will also get a yearly wellness visit. This is just a yearly checkup with the doctor for them to recommend or update someone's prescription to discuss any health concerns that they may be having or want to discuss with them. Routine things like checking height, weight, and blood pressure are routine during these types of visits. Mammograms are recommended for everyone every 12 months for women that are 40 or older. Pap tests and pelvic exams are covered every 24 months or covered every 12 months for women at high risk. For men, prostate cancer screenings are recommended every 12 months for men that are 50 or older. Colonoscopy screenings are also covered by Medicare Part B under preventative once every 24 months if someone's at high risk. If they're not at high risk, it's once every 10 years. Bone mass measurements are covered once every 24 months. Cardiovascular disease screenings are covered by Medicare every 5 years. And diabetes screenings, if someone is at risk for diabetes, lab tests will be covered up to 2 screenings per year. One of the other things is flu shots. Flu shots are covered under preventative care once every single year. Here's something that those that are Medicare eligible use their Part B for a lot. It's the primary care and the specialist visit. Primary care physicians, known as PCP, and specialists are covered under Medicare Part B. Almost 97% of all doctors currently in the United States accept Medicare Part A and Part B. One of the nice things about Medicare is there's no referrals that are required to see a specialist under original Medicare. Outpatient surgeries and procedures. Medicare Part B will cover any medically necessary outpatient surgery or procedures. Here are some of the most common ones: a knee or a hip replacement, a breast biopsy, angioplasty or stent placement, physical or speech therapy, x-rays, MRI or CT scans are all covered under Medicare Part B. Medicare Part B will cover any medically necessary durable medical equipment that someone could medically need. Here are some of the most common that we actually went over a little bit earlier in another video: walkers, crutches, wheelchairs, home hospital bed, oxygen equipment, nebulizers, scooters, CPAP machines, blood sugar monitors, test strips and lancets, as well as insulin pumps and the insulin that's provided with it. Medicare Part B will cover chemotherapy and what's called Part B drugs. See, Medicare Part B will cover medically necessary things like chemotherapy treatment and some experimental Part B drugs. Infusions, such as those that are used for dialysis treatments or at a facility or at home, will also be covered by Medicare Part B. Any type of medically necessary shots or infusions will typically be covered under Medicare Part B. Things like vaccines would also fall under the Medicare Part B. Many individuals will think that ambulance services are covered under Part A since it's associated with the hospital. That's not the case. Ambulance services will be covered under Medicare Part B. They will cover ground ambulance transportation when it's actually medically necessary. Someone may need to be transported to a hospital or a skilled nursing facility because traveling in any other vehicle would endanger their life. Medicare Part B will also cover transportation in airplane or helicopter if it were medically necessary due to the critical nature of that situation. Here's something new that Medicare now covers. Medicare Part B will now cover acupuncture as of 2020 when it's medically necessary to treat chronic lower back pain. See, until 2020, Medicare would not cover acupuncture to treat any condition. Medicare is very specific, though, that it must only be used to treat chronic lower back pain. Medicare will cover up to 12 visits in 90 days. So if someone shows improvement after those 12 visits, Medicare will cover another 8 visits. Medicare Part B will cover up to 20 visits in any calendar year for acupuncture. Chiropractic services. Here's a question that comes up a lot. Medicare Part B will cover chiropractic services for what they call manual manipulation of the spine when medically necessary. So what does that mean? What Medicare means is that the vertebrae is misaligned in the spine from its normal position and it needs to be corrected. This is something that someone cannot do on their own to actually correct it. The primary care physician or specialist will need to order an x-ray to make the determination that someone will need the services of a chiropractor to realign their spine. Medicare will not cover the services or tests if they're actually ordered by the chiropractor. It has to be ordered by the physician or specialist. It's key to understand with chiropractic services that Medicare will not cover chiropractic services used for maintenance or preventative services. Here's some good news about Medicare Part B. Medicare Part B will cover cataract surgery. Medicare Part B will cover cataract surgery when it's medically necessary. Cataract surgery can also be classified under outpatient surgeries and procedures. Medicare does not cover routine eye exams, glasses, or contact lenses, which we're going to talk about in the next section, so be sure to watch that video. But Medicare will pay for one pair of eyeglasses with standard frames or one set of contact lenses after someone's cataract surgery. Cataracts occur when there's a clouding of the eye's natural lenses as you get older, making it feel like you're looking through a fogged up window. Now here's something when it comes to cataracts that most people are confused about. You're not going to be one of them. During the outpatient cataract surgery, the ophthalmologist will replace the natural lenses with an artificial one. Medicare will cover the exams and the surgery and pay for the basic traditional lenses to be implanted to remove the cataracts. Medicare feels that removing the cataracts is their only responsibility. However, many ophthalmologists might recommend a newer upgraded lens that are not considered medically necessary by Medicare or most insurance companies. Think of it this way, it's almost like getting a cataract and LASIK surgery at the same time. For those that decide to go with the upgraded lenses, remember they're not covered by Medicare, it will be on average about $1,500 per eye. Medicare Part B will cover hearing and balance exams, but it's really important to understand what that means. Medicare Part B will cover diagnostic hearing and balance exams if someone's doctor feels it's medically necessary to see if medical treatment is required for a condition. Typically, this exam is used to check for hearing loss or to diagnose the cause of either dizziness or vertigo. Unfortunately, if it is determined that someone could use hearing aids in order to help with hearing loss, Medicare will not cover it, which we're going to discuss in the next section, so be sure to watch that video.